If you have knee arthritis and you'd like to avoid a knee replacement, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to share my top 5 tips to avoid knee replacement surgery. Now, I'll spare you a long introduction and we'll get right into the tips, but if you do have questions as we're going along, leave them in the comments. I do read them and I try to respond to as many as possible. So let's get started. Tip number 1. This one is very important if the thought of knee replacement has ever crossed your mind. And it probably has because you're watching this video. But tip number 1 is to make sure that your knee pain is actually coming from the arthritis on your x-ray. Now, that sounds obvious, but it's very easy to see arthritis on the x-ray at your doctor's office, realize I do have knee pain that's pretty bad, and think that one is the cause of the other. But there are many people with knee arthritis that don't have knee pain. And furthermore, there are many different things besides arthritis that can cause knee pain. For example, muscles, tendons, ligaments, bursa, fat pads, and nerves. And if any of those things are causing your knee pain, then a knee replacement is not going to help you. Furthermore, it may actually make the problem worse because you've just gone and irritated all the tissues inside your knee without actually fixing the thing that was causing the pain in the first place. And that's why roughly 20% or 1 in 5 knee replacements fails to give people the amount of relief they were hoping for because there were other structures that were causing it, and that may not have been an ideal person for the surgery in the first place. And so you do want to make sure that if you're having a knee replacement, that the pain is actually coming from your knee joint. So how do you tell that? Well, number 1 is location. If your pain is really coming from inside the joint, then the pain should feel like it's deep inside the joint, or possibly behind the kneecap if you have kneecap arthritis or patellofemoral arthritis. But if you're having pain on the inner side of the knee or the outer side of the knee, in the back of the knee, or if you can push somewhere on the knee and reproduce your pain, it's very unlikely that your arthritis is causing the knee pain. Additionally, if you can straighten your knee all the way or bend your knee all the way, even if you have arthritis, it's probably not to the degree that you need a knee replacement yet. Because in the very severe degrees of arthritis, the grade 3s and grade 4s, you start to develop bone spurs or osteophytes inside your knee joint. And when you have those bone spurs inside the joint, it prevents you from straightening fully or bending fully. And so that's tip number 1. Make sure that your pain is actually coming from arthritis. Now, for the rest of these tips, we're going to assume that the pain is actually coming from the arthritis inside the joint. So what do you do to avoid surgery in that case? Well, your knee joint is primarily a forwards and backwards joint. It does have some degrees of side to side and rotation in it, and those are very important to normal knee function. But if you get too much of that twisting and rotation, it twists and grinds the arthritic joint surfaces together. And knee arthritis pain isn't necessarily caused by the presence of arthritis, but it's when those two worn down joint surfaces grind on each other and cause inflammation. And then the inflammation is then what causes the knee pain. So if you can prevent too much twisting in your knee, you prevent the buildup of that inflammation. Now, sports like golfing or tennis or pickleball, where you do a lot of twisting at the hips, can cause twisting inside the knee joint, but you can still continue to do those things in most cases if you have knee arthritis. You just have to learn some modifications to cause less twisting in the knee joint. Now, that's a little outside the scope of this video, but I do have some other videos that I'll link to help you learn how to do those activities more comfortably. But another big thing that causes twisting inside the knee joint is overpronation when you're walking. And overpronation means that your foot is flattening out too much and your knee is going inwards. Now, what causes that? Well, largely it's not the knee itself. It has more to do with the foot and ankle and the hip. In fact, I tell many people that knee problems largely are foot and ankle and hip issues in disguise. So tip number 3 is going to address the foot and ankle component of overpronation. The two biggest things in the foot and ankle that cause overpronation are 1, weakness of the foot muscles, and then 2, stiff calves. If your foot muscles aren't strong enough to support your arch, then you don't have a firm foundation to push off of, and so your knee is going to go inwards even if you have sufficient strength out of your hips. So first of all, you need to be able to maintain your arch when you're walking. And you can do that by pulling the ball of your foot towards your heel and just slightly scrunching your toes. That will, in most cases, turn your knee out a little bit and prevent it from overpronating or going in too much. So that's the first component. Additionally, if you have too much stiffness in your calves, then when you go to take a step, you can't progress your body out in front of your foot. And as a result, your body has to find an alternate path around your foot, and that's often pronating so that you can go around the foot. But that again can contribute to too much twisting inside the knee joint. So it is important to stretch your calves, but it's important that you stretch them properly. Because a lot of people, when they're stretching their calves, they'll allow their foot to turn out, their foot to flatten, and that's actually causing pronation when you're trying to do something to prevent pronation. So you want to start out by doming your arch like we talked about before, then taking a short step and keeping that arch domed, keeping your heel flat on the floor while stretching. And then hold this ideally for at least a minute, preferably 90 seconds if you can. And that'll help you get more flexibility out of your calves so you can take a longer step when you're walking without causing too much twisting at your knee. Now, if you have a good enough foundation in your foot and you have enough flexibility in your calves, another thing that can cause overpronation is your hip. If your hip muscles are too weak or your glute muscles are too weak, then it can cause your knee to go inwards. You've got 3 different glute muscles: your gluteus maximus, which is the big muscle, your butt muscle on the back, and then your gluteus medius and minimus on the sides. And largely it's the gluteus medius and the gluteus minimus that control that side-to-side motion. So a good functional way to strengthen your gluteus medius and your gluteus minimus is just to practice standing on one foot with your arch domed. Now, if you don't have good enough balance to do this initially, you can hold on to a wall or a chair or a cane or a walker, anything to help keep you stable. And then once your balance improves, then you can start letting pressure off until you can do this on your own. And being able to stand on one foot for 10 seconds or longer greatly reduces your fall risk, in addition to helping to make your hip muscles stronger. Another good glute strengthening exercise is doing lunges or partial lunges, where you're going up and down, putting pressure through your heel, and that helps strengthen your gluteus maximus for activities like getting up and down from the floor, squatting to pick something up, going up and down stairs. So lunges are a very good functional glute strengthening exercise, as well as they help strengthen the gluteus medius and minimus by keeping your knee in a neutral alignment and not letting it go inwards as you're doing a lunge. Now, once you've made sure that your foot muscles are strong enough and your calves are flexible enough and your glutes are strong enough, the next thing is to be able to walk longer. Because honestly, it's the inability to walk as long or as far as you'd like that drives most people to seek out knee replacement surgery. And so if you can walk longer with less knee pain, you probably won't need a knee replacement, even if you do have knee arthritis. So how do you do that? Well, one easy way is to take slightly shorter steps. By taking shorter steps, you don't have to be on one foot for as long. So if you've got some weakness in your hip muscles or in your arch muscles, it prevents how long you have to hold that position. Additionally, if you don't have good flexibility in your calves, taking shorter steps prevents you from overpronating to find a way around, because you don't need as much of flexibility when you take shorter steps. Now, eventually you do want to work to being able to take longer steps, but in the short term, that'll help you walk longer, which is good for your cartilage health, without causing too much twisting at the knee joint. Now, an additional tip that can help is using a cane or a walker for at least a short period of time while you're getting your hip muscles stronger and your foot muscles stronger and your calves more flexible. Because walking is actually really good for your knee joint. It helps improve your cartilage health and secretes a lubricating fluid called synovial fluid. But if every time you take a step you're causing too much twisting at the knee, it's not good for you and it's going to increase your knee pain. So using a walker or a cane will allow you to walk with less twisting in your knee, and by doing that, you get stronger, you improve your cartilage health, and you decrease the risk of needing a knee replacement. So in summary, the 5 tips are: number 1, make sure your pain is actually coming from the knee joint. Number 2, avoid over twisting your knee, which can come from, number 3, weak foot muscles or stiff calf muscles. Or number 4, weak glute muscles. And finally, number 5, you want to walk as much as you possibly can, but do that without overpronating and without causing too much twisting at your knee. And you can do that by taking shorter steps and or using a cane or walker to walk at least for a short period of time. So hopefully you did find this helpful and you're able to avoid a knee replacement surgery. Now, if you would like some more tips on how to be able to walk longer with less knee pain, check out these other videos over here. Or if you're in the St. Louis area and you'd like some more in-person help, just contact us at More for Life and we'd be happy to help you. Thanks for watching, and I'll see you in the next video.